Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sinise. We meet every Saturday at 10:30 a.m. Central Time. And if you're watching us live, we're on YouTube and Facebook Live every week. And you can always watch our on demand by going to our uropatient.com website, where you'll find all of our past episodes. Also, the best place to go to get any of our handouts. We've got a bunch of them, so go and check those out. Every program I put out, I have a handout with valuable information for you guys. So let's get started with our show this week. So this one I get a lot of questions about. It's urodynamic studies. What are they? Why do I need this? So I thought I'd do an episode on urodynamics just for you guys. So first of all, what is a urodynamic study? It's a study, it's a series of tests actually that check how well your bladder, the sphincter muscle, the one that kind of squeezes to keep you from wetting yourself, the urethra, work by storing and releasing urine. It's a way that your doctor can understand how well your lower urinary tract is working. That's done in the office, so it's an office-based test. So why might you need a urodynamic study? Well, all these symptoms you see listed there: frequent urination, urgency, difficulty urinating, painful urination, urinary tract infection, and incontinence. All these symptoms can be due to various conditions, and the urodynamic study really helps to pinpoint the exact cause. Now, this is a picture of what looks like what's going on during normal urination. So during normal urination, the bladder undergoes two phases: the storage phase, as we see up here, and the emptying phase. Urodynamics is a way of looking at that through a tracing like you see here by having pressure monitors. So we look at the storage phase and then the we call the filling phase. Once the bladder is full, then we look at the voiding phase. And we get the information about how well the bladder is doing what it should do, because once you decide it's time that you can go ahead and urinate, it should relax the sphincter and squeeze with the detrusor, and then have an expulsion of all the urine, and should completely empty out. So again, a little diagram of how this works. So we start to get a feeling of sensations to void as it starts to fill, and then normal desire to void. And actually, during the test, we're going to ask you some of those questions, like when do you first feel like you have to urinate? And when do you have to really feel like you have to urinate? Those are kind of important. We want to test how well you're understanding your bladder sensations. Preparation for the test. Well, the first test I usually do is a uroflow test to measure the flow rate and volume of urine during voiding. So I say come in with a comfortably full bladder, because we're going to ask you to urinate before we do any of this testing stuff. So before you have any probes put in, we're going to just take almost like a normal urination. You'll sit on what looks like a normal toilet, or if you're a man, stand on what looks like a normal toilet and empty. During the test, the patient urinates into a special device called a uroflow meter. That's the thing that's going to measure the rate of urination. I say it's like the radar gun, from the cop, seeing how fast the urine's coming out. Also, at the end, we get a urine sample from that urine that you just expelled, and I check it for infection. It's kind of important, because if you had a urinary tract infection, then the next step of putting catheter tubes in is probably one I want to avoid, because it's a risk of causing more infections. Number two is it also can interfere with the results of the test. If anybody's ever had a bladder infection, you don't hold as much urine when you've got an infection. The bladder is constantly trying to clear it out. So that would really give us a bad result. So we want to make sure that your urine's clear, no signs of any infection. So that's the easiest part. Then we go and we do the filling test. And what that what that will involve is a thin tube called a catheter will be gently inserted into your bladder. Now, this might feel a little uncomfortable, but it should not be painful. The catheter will be used to fill your bladder slowly with sterile water. You'll be asked to tell us when you get the first sensation, like you feel like you have to urinate, and then when your bladder feels full, like you really can't hold it any longer. So as I mentioned from that previous slide. So what we're doing is looking for the sensations that you should normally feel as your bladder fills up. Second half of this is the voiding side. So this is when you're emptying your bladder. After the bladder is being filled, we want to actually, while your bladder is being filled, we want to watch the pressure inside your bladder and in your abdomen. And I'll show you a little bit about how we look at that in the next slide coming up. But anyway, what we want to make sure is that as your bladder fills, we don't want to see it jumping up and firing off on its own. And that can sometimes happen. That's one of the problems we look for. So we'll be watching as it's filling. And then once your bladder's full and you feel like you can really urinate, then we'll actually have you stop. We'll stop filling your bladder, and then we'll have you go ahead and urinate. And we'll measure the strength that your bladder squeezes with, as well as that radar gun checking for the flow. Now, this is what early urodynamics used to look like, probably the early 1900s. It took 1, 2, 3, 4 people to do it. And this poor guy had to endure this. They're actually pouring water, and this guy's looking at a flow meter over here. The concept has really remained the same, but done by one person with a nice, fancy, modern computer. And as you can see, we've got something like this in our office, and we can watch these little measurements on that computer screen. Now, I like this slide because I think it really breaks down what's going to happen and what we're looking at. So we're going to be placing catheters. Actually, 2 catheters are placed. One's placed inside the bladder that you see right here, and the other one is placed either in the rectum for male or female patients, either way. And for a female, you can also do it vaginally. This catheter in here is called the bladder pressure. That's why they call it P abdomen. So what happens, it's not your bladder pressure, it's your abdominal pressure. And what that does is tell us if you were to cough or sneeze or something that increased the pressure inside your abdomen, we can register that. This one here in the bladder should only register what happens in the bladder. But if you were to cough or sneeze, it'll also transfer to the bladder. So that gets important. I'll show you a little bit about how we see that. So 2 catheters, one placed in the rectum or vagina, one placed in the bladder. The bladder one is also hooked up to water so we can fill it. Now, here's the magic that the computer does. So it looks at the pressure in your bladder, looks at the pressure going on in the abdomen, and it does a subtraction for us. So it takes out any what we call artifacts or abdominal contractions. So if you were to cough, sneeze, it'll still stay nice and flat. That's important when you're doing the test. Now, here's an actual voiding pressure flow study, fancy name for what we do. We're filling you and having you empty. And what we can see here is this first line up here is what's called the EMG. So we put a little stickers on the, like when you have an EKG done of your heart. So we do it to the muscles over by the sphincter. So we kind of put them by your buttocks. They're just little stickies, so no pain. And it measures how well the sphincter muscle is relaxing and contracting. So as it fills, it should be contracting. As it urinate, it should empty. That's important to know. Now, here's that P vesicle. That's the one inside the bladder. Here's that abdominal one. That's over here. And here's our magic one measuring that subtraction. Now, what you see right here is I've asked the patient to cough. I had him cough a couple times. So we can see that it's showing up in both channels. It tells me 2 things. Number one, it tells me the urodynamics is working and my measurements are working. So, and it also tells me that it's getting good readings. This bottom one is called the UroFlow. So that's that first test you did, that speed test of the urine rate, and it'll measure that during this test. So this time we'll be filling you up. So again, we're going to ask you when you feel your first sensation. That'll give us a number, how full your bladder is. We know what those norms should be. And then how much can you hold completely? There's a little blip right there, but you see it's in both channels, so it means nothing. Now the patient was told to go ahead and void. I think I had him cough just to make sure that everything was set to go. And I said, go ahead and urinate. Patient goes and urinates. We see it go up in this channel, not in the abdominal. So we know it's really the detrusor that's squeezing, and that's why it shows up in this channel. So it gives us a nice look here. And then it gives us a flow rate. We can look at what we're most interested in, is this peak flow rate and how much pressure it takes to achieve that. That'll tell us how well the bladder is working and how much, for a male with a prostate, how much obstruction there can be. A lot of great information from one simple test. So as we mentioned earlier, what does it tell us? It tells us bladder capacity. How much a normal bladder should hold? Most bladders should hold anywhere from 300 cc's to 600 cc's. How well does it empty? Does it get all the urine out, or is it leaving a lot behind? That's important. Those pressure measurements, we know that if it's working too hard, it could be blocked. If it's not working hard enough, it could be weak. And again, muscle and nerve function. So how well the sphincter relaxes during urination versus how well it grips while you're not urinating. So all those things found in this test. So what about after the test? It's possible you may have some mild discomfort when you go to urinate, a little bit of burning. We did have to put a catheter in. The catheter we use is the size of spaghetti. It's a very small tube because we don't want it to be able to interrupt the flow of urine. So it's a very small catheter, but it can cause a little bit of discomfort. You should drink plenty of water just to kind of wash things out. And then if you have any problems, be sure to contact your doctor's office. Let them know what's going on, especially something like a high fever or if the burning doesn't stop or something like that. Again, why is this important? We can't, you can guess about all these things, but it's really allows us to personalize your treatment plan. I always say urodynamics is like when you're putting a puzzle together. We take all these little pieces and put them together. Urodynamics is one of those pieces, but it's the final piece a lot of times in the puzzle. So remember that. Of course, good information gives us better management of symptoms. Better management of symptoms going to make your life better. So in conclusion, we know why it's important. We kind of talked about that. Feel free to send me any questions. You can go to UroPatient.com at any time and just tap in a question. Or if you're watching the video in the comments section, go ahead. I'll be glad to answer those. And once again, I'd like to thank you for listening. I thought this would be an interesting topic to talk about. Don't be so afraid of that test. It's not such a bad test. And tune in next week for more on the UroPatient podcast. Thanks for watching.